Hello, everyone. Thank you for joining us today for the Administration for Community Living Caregiver AI Prize Challenge informational webinar. I'll briefly share a few logistic remarks. All attendees, other than our panelists, will be muted during the presentation to minimize background noise. Closed captions are available and can be turned on using the CC Show Captions button in the Zoom toolbar. ASL interpretation is available and the interpreter will be spotlighted on screen throughout the event. Please submit any questions at any time using the Q&A question bar, also in the Zoom toolbar. The webinar is being recorded and slides will be shared after the meeting. If we don't get to any of your questions, we will provide an answer in an updated FAQ following the webinar. And lastly, if you experience any technical difficulties, try leaving the meeting and rejoining using your original Zoom link. And that's all. Thank you. And I will hand it off to Kelly.
Thank you and welcome, everyone. Thank you for making time to join us today. I'm Kelly Cronin, Deputy Administrator for Innovation and Partnership at the Administration for Community Living. Thanks again for joining this second webinar for the Caregiving AI Prize Challenge. Today we'll be starting with covering an overview and some updates about the challenge to provide you with a little more information for everyone who is intending to apply. We'll also be spending the majority of the webinar focused on the caregiver experience and insights on how AI can best support caregivers. We're going to hear directly from two national organizations, the National Council on Aging that runs ACL's Direct Care Workforce Strategy Center and the Caregiver Action Network. We're also excited to be joined by 3 family caregivers and 2 direct support service providers, and they're going to be able to share their personal experiences and insights to inform your solutions and your work. So with that, I just wanted to refresh on some of the problem that we're trying to collectively address and the goal of our challenge, and give a quick recap on the design of the challenge. So I think we all know that the demand for home care is surging. We're going to need another 800,000 additional direct care workers over the next decade. And we also know that 63 million family caregivers are already facing growing physical, emotional, and financial strain. AI has a huge potential to make a transformational impact in this area, but we currently have limited best practices for responsible use of AI as a tool to support caregiving. So our goal is to drive innovation and encourage affordable, user-centered AI tools that improve quality of the care, reduce caregiver burden, and extend the direct care workforce, supplementing but not replacing human connection, which is so essential to this work and to the recipients and the people we're aiming to serve. So a quick recap on the design. We have 2 tracks. The first track is AI for caregivers, both paid and unpaid caregivers in the home. And track 2 is really more aimed at the provider or the agency that is using AI tools to extend the caregiving workforce. So each track is going to we're going to run through each phase. So phase 1 is our design phase, which we're currently in. Phase 2 will be focused on implementation and testing. And phase 3 is the promise of sustainability. In order for a team to get through all 3 phases, they have to win an award at the preceding phase. So with that, I'm going to turn it over to Camille Null-Hunter, who's going to go over some updates about the challenge. And also, I think you might have already seen the poll that popped up, but we'll quickly recap on sort of who's participating in each track. Camille?
Thank you. Working on getting off of mute. Thank you everyone for joining us today. I just want to cover some quick updates that we have for the Caregiving Challenge. First off, ACL has launched a Slack workspace. This is a place for interested applicants to connect with each other, share ideas, learn from peers, and explore potential partnerships. This is entirely optional, but if you are interested in joining, please email us at the Caregiver AI email address you see on screen and just let us know why you're interested and what tracks you're considering and your contact info. And we will work on approving you to get access. Quick note, this is for connecting with peers, not federal staff. If you have questions for the Challenge federal team, continue to email the Caregiver AI email address. Next slide. So we are excited to say that we just launched in the last 24 hours some additional information on the Challenge website. You will see the link here and we'll drop it into the chat. We've released this guide to provide a little bit more information on how you can show your AI solutions performance and technology readiness. We have a few overarching concepts that we would love for folks to be able to highlight in their narrative and appendices, just touching on concept feasibility, such as have you explained the scientific or engineering basis for your solution and provided the technical breakdown for your AI model. Experimental validation, have lab tests been performed and are your results reproducible and consistent? Relevant environments, has the solution been tested for use in relevant environments to what we're talking about today? The critical technology elements, have the key components been tested? And are there documented results and design for information? Additionally, we have some suggested evidence that the challenge team has identified some basic performance metrics and tests that can assist with the evaluation of your solution and technology. Some of these will fit into the narrative and appendices, like I just noted, such as the basic bench test performance metrics, or the model evidence. However, we've also now updated our application instructions to allow for an additional submission of data output logs. These logs can include some of the suggested tests that the challenge team has designed. Some of these we refer to as the Smart 40 validation logs. So that's more information there on the guide link. Or you can submit your own tests or evidence within this additional submission. These logs are simply supporting evidence for the case you're making in your narrative and appendices, but these logs will not count towards the page limits that we have posted. Next slide, please. Paired with that, we have some small changes to the instructions on the website that are now live as well. First off, we just wanted to note we're expecting applications to be primarily a narrative format. Certainly some bullets or some tables are understandable, but we're really looking to have kind of a clear description of what you all are submitting to really paint the complete picture. We've also included in the application instructions a one-page cover page. This is putting the applicant information into a one-pager that also will not count towards the page limit. Additionally, to support our challenge judges, we're requesting that all submissions be 508 compliant. I've provided some links here that are from the section 508.gov website that can help you understand how to check if your documents are compliant. Additionally, we're asking that applications use the exact section headings in the application outline to help us easily evaluate your application. And then, as I discussed, we've updated this option to send test logs that do not count towards the page limit. Please note these files should still be in a text document version, either Microsoft Word or PDF file format. Please don't submit JSON, CSV, or Python files. We will have difficulty reading them. Please put them in one of the documented file formats. And then finally, if you are submitting multiple applications for distinctly different solutions, please submit one email per application to the Caregiver AI email address by the deadline. So anyone who has already submitted an application is welcome to update their application by the deadline if they want to, say, add test logs or update any of these other instructions. Okay, next slide. So this is just a quick overview again of the submission for the application. As I noted, we added the cover page that will include the abstract, and these are the headers that individuals should be using or teams should be using in their applications. You'll see these sections over here under the project narrative on the left. We've also included in this slide just notes about the evaluation criteria, which is published on the challenge website. The categories are posted here, and the evaluation criteria is a little bit different for track 1 and 2. So we encourage you to go check out the specific information on the website. Okay, next page, please. So just reminding you of key dates, our deadline for phase 1 applications is due July 31st by 5 p.m. Eastern. And then we hope to announce winners by September, at some point in September. So we are looking forward to reviewing your applications. All right, I am going to turn it back over to Kelly to kick off our speakers.
Thanks, Camille. So we're now going to transition to Nicole Howell, who's the director of the Direct Care Workforce Strategy Center. She is currently leading a Direct Care Workforce Intensive as a part of the H+ Action Conference going on in DC this week. So she was able to record a message for everyone, and you'll get to hear from her now. She does have extensive leadership and hands-on experience related to the direct care workforce and training of the direct care workforce. So we're happy to be able to incorporate this into our webinar today.
Hello, everyone. My name is Nicole Howell. I'm the director of the Direct Care Work Resource Strategy Center at National Council on Aging. Thanks to the Administration of Community Living for allowing me to participate in today's webinar, even if I can't do it in person. I hope you'll forgive me. So again, the Strategy Center, we are charged with the critical broad task of supporting states to improve their direct care workforce. They do that by sort of expanding, strengthening, and enhancing the direct care workforce through a variety of means, but our chief function is we provide technical assistance, or TA, to states to help them identify, work towards, and achieve a milestone. They do this over the course of generally 9 or 12 months, although we do have some shorter options. But the states come together across cross-states teams, working Medicaid, disability, and aging, and education, and workforce pipelines to come together and take a broad, big look at the challenges they face in their state and work towards a solution. We also enhance this and sort of supplant this, or not supplant, but supplement with some peer-to-peer learning. Our states meet monthly in peer learning collaboratives that help them to hear from expert speakers, and they get to hear from other states and how they're addressing this work, and this catalyzes the learnings that we see. Lastly, we develop tools and resources things are applicable to states and stakeholders to help them address this issue. It could be free webinars, that one we'll talk about later on in this presentation. Also web-based workshops to help states dive deep into a topic and not us, that could be augment their technical assistance. Those things can be like data or cross-agency collaborations or working with providers and establishing advisory committees, big broad initiatives. And then also one thing, which is we're going to talk about shortly, is reports, briefs, and toolkits. We're going to talk about a series of reports that we've done about artificial intelligence and how this intersects our work a little bit. Now, to date, we've worked with 27 states and the Commonwealth of Puerto Rico over the course of 3 rounds of technical assistance. We're getting ready to head into our next one. We're currently working with 17 states in the Commonwealth. And we have learned a lot over the last several years about the challenges states face, opportunities that or barriers that they might encounter, and really how we might support them in that. It's an exciting time in the direct care workforce. There's a lot of innovation happening, and there's a lot of lessons to be learned. Now, at the Strategy Center, we talked about those resources a little bit. We have a series of reports coming out called A New Era of Care. In fact, you can access them now, and I'll provide you that link shortly. Now, it's critical as we talk about this that we really emphasize the direct care worker and who those individuals are. Now, the direct care worker is encompassing of a broad range of titles like direct support worker, certified nurse aide, personal care attendant. These individuals make up a collective workforce in the United States of about 5 million individuals, but there's about 3.2 million working in home and community-based services. And these individuals provide critical services, the activities of daily living like bathing, dressing, medication management, making our lives possible for both the individuals receiving care and the family members who are supporting that care period of time. So again, those are about 3.2 million workers, but over the next 8 years or so, we're going to need 9.7 million additional job postings to fill those direct care workers. Those are including turnover and care transitions. But we're also going to need about 700,000 additional jobs. That means in addition to what we have now, we're going to really need, growth of about 750,000 roles. That's the fastest growing workplace sector of the country, which is a significant opportunity to identify what this workforce would want in order to really enhance their skills and enhance their ability to deliver that amazing care. Now, unfortunately, 36% of this population of the direct care workers live at or in poverty. About 49% rely on some sort of public benefit, be that Medicaid, SNAP benefits, or other wraparound support services. There's a lot of opportunity for innovation in the space in many areas that we are looking to address. But I hope that as you conceive of this work, that you think about how artificial intelligence can address some of the tools and support this workforce might need. But as you think about this workforce, I think it's important to note that they work right alongside family members. There's about 63 million family caregivers in this country. They average about 51 years old, and they report they, on average, are providing 27 hours of care a week. That is, more than a part-time job, right? And about 50% of those family caregivers report one negative financial impact, whether they've had to reduce their hours of work, maybe take a job that pays them less money, but they have more flexibility, or maybe that they are paying for tools and resources needed to help care for their family member. They provide an estimated $600 billion in unpaid care every year. This issue is an area related to social service and support, but it's also deeply one about economic impact. And there is a really opportunity to empower ways to help this family members continue to be a part of this support services and also ensure that they are supported as well. So the Direct Care Workforce Strategy Center is very interested in how innovations might support this field. And we have authored and recently released a series of 3 reports. You can access them using the QR code. We call it A New Era of Care. The first report is sort of a scan of what's going on in the sector broadly, meaning where is AI already in the sector? The second, technology with a human touch, sort of looking at sort of 40 core responsibilities, 20 of that at the employer, 20 of that at the direct care worker, and how those areas are either impacted by AI, could be, and what are the areas we should be aware of and mindful. And the last is hearing from a team of distinguished experts like the direct support professionals you're hearing from today, as they talk about their experiences, hopes, and concerns about this space and how AI might be used to enhance their well-being and how they would like to see it developed. Now, I've learned a few lessons over this work, by no means an expert, but I think the first is that workers have to be at the design table from the beginning. They know their job far better than any of us. They can tell us what's working and what's not, what technology they're already using, and how it might be adapted to leverage and expand their capacity. Client community voice are critical. We must also hear from the individuals receiving care, the older adult, the individual with disability, the care team that surrounds them, including their family, and what would be most impactful to them. We need to supplant this with research and real-world evaluations, both hearing from providers about how they're using this technology, collecting data. This is an exciting opportunity to us all work together to understand truly how could we leverage this across settings. We need to look at funding mechanisms, how these are paid for and how they are made accessible to individuals. Absolutely strong privacy protections and accessibility by design. We are at the forefront of this technology, and based on all of the years of information we know about leveraging tools and technology and resources and potential pitfalls, we can really make this accessible at the beginning. It's truly a unique opportunity. Lastly, I want to invite you to join our webinar on July 22nd. We are again going to be diving deeper into the space about AI and direct care workers' perspectives on adoption, ethics, and what comes next. We're going to have Robert Espinoza of the CareWorks projects, Gabriel Sador, the Chief Operations Officer and Foundation Director at NCORE, and Kelly Cronin from the Administration on Community Living, sharing the broad perspective of how AI is working, what can be enhanced in the future, and what's possible in this space. So as I conclude today, I want to, first of all, please feel free to reach out at any time. But I also wanted to offer to you that you are at a critical juncture in this development. You are going to get to design tools and resources and try and expand our learnings. And I'm so excited to hear about those and hear from you what's working and what's not. But I want to encourage you from the beginning to center the worker's voice, to connect with the providers and individuals who are going to be using these tools, and to ensure that they are accessible to a broad range of audiences and that states and agencies can access them. So thank you so much for allowing me to join you all today. I look forward to hearing about your work and wish you the best of luck.
Okay, we're going to go ahead and transition to our next presenter, Marvell Adams, who's the CEO of the Caregiver Action Network. He's an educator, a leader, an advocate with a lifelong commitment to supporting caregivers. The Caregiver Action Network is a non-federal partner to ACL with this Caregiver AI Challenge. And I think you're going to learn a lot from the information that they're going to first present, and then also facilitate a conversation among caregivers and direct support professionals. Marvell?
Thank you so much, Kelly. Just really great to be here with y'all. And just a short introduction of our team that'll be joining us across this conversation. I, along with our business development associate, Tal Sheckman, will be doing the presentation around our Caregiver Tech Insight Survey. And we'll tell you a little bit more about that in the next slide. And then for our roundtable discussion, I'll be working with our Director of Community Initiatives, Nicole Goebel, who is our lifeline to many of our caregivers, hundreds of caregivers in our Caregiver Insight panel, as well as thousands across our listserv. And then also joining us for supporting the team is Amira Bilal, who is our Vice President of Programs and Policy. So just a huge welcome to everybody for joining us today. Caregiver Action Network has a very large mission for over 30 years, having served and supported all family caregivers across this country, across all 50 states through our engagement activities. And we really appreciate you guys joining us today. Next slide. So, Tal and I are going to talk a bit about a really insightful survey that we participated or that we completed with in conjunction with our Caregiver Innovation Council, which helps advise and work with Caregiver Action Network to really help inform us about what things are coming out in the field, the type of technology that may be supporting family caregivers, as well as finding ways to ensure that the caregiver's voice is infused into that technology evolution. And obviously today's webinar and the AI challenge is a part of that caregiver voice being included. So just to give you a quick understanding of what this survey entailed, and so Caregiver Action Network has an outreach of about 30 to 40,000 caregivers across our email and social media and more. And we sent out the call with a survey around a whole host of questions in finding out about what type of technology, what type of innovation, and gaining the insights of the caregivers on what they really wanted to see, what fears they had. And so what we're going to do across these next few slides, Tal and I, is give you an overview of that survey. This is not the full survey. We will be releasing a public version of this soon to come out. So if you miss anything today, we certainly will have more information along with the debrief that will be coming out from ACL. But just to give you a sense of who participated in the survey, of those 30,000 or so, we validated and ended up with about 272 survey respondents and had a really good validated set of participants. Just for demographics sake, we had about 40% of individuals that participated, 40% of people participating that were 35 to 49, and then an additional 30% or so that were 50 to 64. And so really 2/3 of the individuals that participated were in that 35 to 64 range. The majority of all of our participants were actually providing care for 5 or more years. So that's a pretty significant chunk of the respondents and how much time and energy they're putting across a longitudinal scope. Parents and in-laws were the most common care recipients. Around 40% of the individuals receiving care that caregivers were supporting. And again, we're talking in this survey about unpaid family caregivers for the most part. And then followed by spouses receiving support and partners at 25%, with about 22% of children under the age of 18 and adult children being supported as well. And the top conditions that were noted that caregivers were supporting their loved one that was navigating these issues would be dementia or cognitive impairment or Alzheimer's disease, about 32%, and then followed by general aging around 29%. So a really interesting cross-section of respondents as well as topics. Tal, I'll let you take the next slide.
Thank you. Thanks, Mobile. Here we'll talk a bit about the time burden of care coordination. So as you see here, 37% of caregivers said they spend 11 or more hours every week just on care coordination tasks. And it means it's basically not providing care or providing care indirectly. So it means the focus here is on coordinating care. So the coordinating aspect of care, and it's basically a full or almost a full extra day of work every week. And you can see here on the left the hours breakdown. So when we look at what's eating up the time, it's really, and here you can see on the right, it's really things like managing medications and refills, scheduling appointments, dealing with paperwork, forms, tracking records, calling doctors' offices. So all of those are those kinds of things that are repetitive administrative tasks. And technology, particularly AI, can make a real difference here. And I think that what's also worth noting here is that this coordination labor, in many ways, is invisible. So it doesn't show up in any medical record, or it's not being reimbursed. So it's rarely acknowledged by by the healthcare system or by any other system for that matter. So when we talk about building AI tools for caregivers, we are not talking we are not only talking about automating something that already has some sort of infrastructure. We are talking here about building infrastructure for work that the system has never even recognized exists in a way. So I think that's really interesting. I'll hand it to you, Marvel.
Thanks so much, Tal. So on the next slide, so we also were curious to find out about how organized or fragmented does the overall care coordination feel on a typical day. And so, we hear that caregivers are overwhelmed. We understand that our caregiver support system in the U.S. it can be fragmented and siloed in places. And so that care coordination piece and understanding what that can feel like on a usual day for them. So the feedback was really interesting because what we found is that nearly 1 in 3 caregivers report that their care situation feels fragmented. And so understanding that they did not feel it was cohesive, coordinated, or comprehensive in a way that they could navigate what they would feel to be a system, but instead really them working between disparate parts across whether it's different tech systems, whether it's analog versus digital, whether it's phone versus text, but working across a lot of different areas. And only 21% described their situation as very organized. And we have yet to do this. We need to plan a session to really do a deep dive with those individuals, because that is impressive when you are a caregiver and really leaning in and feeling well organized. So, the top care coordination challenges that came up, as you can see here on the right in the orange bars, is lack of time, which makes perfect sense. And we encouraged folks to pick as many of these challenges as they'd like, so they don't necessarily add up to 100%. But then information across multiple systems, which we found that to be a theme throughout our survey, that it wasn't just that individuals were coordinating care with one particular system. It was coordinating of care in one system for one particular set of issues, another system for another set of issues, and another set of issues in a different system. And then, of course, the number of providers, whether that's specialists, PCPs, additional doctors or physician assistants or nurse practitioners that they were engaging with, or even hospital infrastructures, especially when you're talking about cancer care. And then lastly, I'll just mention that insurance complexity was a third of folks noted that one. And just again, it was a matter of them having trouble navigating a system that from their perspective as a caregiver was either complex or just too confusing to be able to consistently navigate. That's all.
Next slide, please. Okay, so technology currently in use. So let's start here from what's really encouraging. So we see that caregivers are already using technology, obviously, and 72% use smartphone apps, 68% use online patient portals, and over 40% use telehealth and remote monitoring. Only 10%, as you can see here, said that they use no technology at all. So this is definitely not a population that's resistant to tech, for sure. But what you'll notice is that tools, many of the tools caregivers are using are mostly provider connected or familiar platforms many times. And it looks like there is a real gap when it comes to tools designed specifically for caregivers for their own coordination needs. So I think it really shows and tells us that caregivers have been adapting to tools that were built not for them, so that were built for patients, or providers many times, not for caregivers. So there are, when you see here that caregivers are using patient portals, it's just that's what's available. and not because it solves their own coordination problems, for instance. So again, the opportunity is not just to build better technology, it's to build this entire sort of first generation of tech that actually treats the caregiver as the user, not just as a bystander in someone else's system. So I think that's really, really important and interesting to see here. Marvel, please. And, sorry, but I would also just mention that I've just noticed in the questions, we see the question, and to receive a link to those results. And I think Jody posted the link to the survey itself, but we will provide the link to the results as well.
Thanks, Tal. So on the next slide, if you could, we are going to talk a little bit about, we asked about the types of tasks that caregivers would most like help delegating when it comes to using technology. And this was really insightful, as you can see, tracking follow-ups and care plans. And so there was a theme, not only with that top answer, but also throughout this, around being able to kind of have another brain that can help coordinate, and not coordinate, but help really track across multiple systems, again, whether it's follow-up and care plans, or finding services and providers, or managing prescription refills, each of those having different systems that they're having to engage with. And so, you look at those top three answers with the, 43% of people denoting each one of those, and you recognize that those are very core things that happen, that caregivers have to keep an eye on, but they're things that they were comfortable having some delegation to, whether it's AI or some type of technology. And then when going to coordinating between doctors, that was right on the heels, and might as well say it was right there with the other top three. But that was another area where caregivers really chimed in because of the time that it takes, even if they're using a web portal access to be able to make those appointments, but recognizing that you're talking about many times caregivers making appointments for multiple doctors and multiple specialists. And so it's not just an annual physical or something along those lines, but you're talking about really coordination across multiple specialties in some of these instances on an ongoing basis. The other piece of this, of recognizing that about 21% of the individuals that you see at the bottom of there would prefer to handle these tasks themselves. And so our kind of assumption with this is that they aren't using, would prefer not to use technology, or at least aren't interested in delegating it. But it gives you an indication of comfort with these delegation of tasks, and really caregivers, and we'll talk more about that in our roundtable, about what is it that they really do trust or not trust AI to be able to provide, or technology solutions to be able to bring forward. But around application preferences, it was also interesting to see that, there was a theme around wanting to make sure there was just not another homework assignment. So an app that was hard to understand, or an app that was not very user experience friendly, that was going to be more of a burden, or more of a homework assignment than really something that was going to be able to help them. And so the ease and use of applications, being able to open them, but having them set up and genuinely helpful, being comfortable with multiple apps if each serves a specific purpose, but really being able to have a value proposition around why this app is going to be helpful, and particularly when it comes to the value that could be brought from an application that exists to help bring together a universe of technological platforms they may be engaging with. Tal?
Next slide, please. Please, if you would turn over to the AI slide, to the next one.
Oh, no, I think it was there, Tal. There it is. Yep. Are you able to see it, Tal?
Oh, now I can see. Thanks. Okay, so AI tool adoption. So here we see that, and that's really interesting. 59% of our respondents, 59% of caregivers, have already used AI for caregiving. No, not this one. Yeah. th- 33% use AI regularly. Another 26, I think, 26% tried it at least once. 17% haven't tried it but interested to try. And we see here 76% total who are open to AI. And here on the right, the top use cases are understanding and diagnosis, preparing questions for doctor visits, organizing medical forms, managing bills. And when we say here admin coordination, this admin coordination category, it also relates, just to clarify, it also relates to financial management in a way that many caregivers use AI to help organize bills, draft financial correspondence, and in general, navigate all those financial complexities of caregiving. I think that what we see here, it's really interesting to see this pattern of use cases. We see, so understanding the diagnosis, preparing questions, organizing information, all of those things are they can be managed by a good care coordinator, and caregivers are essentially what they're doing is using AI to build themselves the support system that they're not getting from other systems. And we asked in the question was specifically, I think it was ChatGPT, Claude, and Gemini. We said, for instance, Claude, ChatGPT, Claude, and Gemini. So caregivers are not using AI for convenience. They're using it to fill a structural gap in how care is coordinated. They're solving their own problems, and I think it shows that this demand is real. It's definitely not theoretical. It's real. And what's missing is not willingness. It's really purpose-built solutions that meet the standard of privacy, trust that caregivers deserve. And we'll touch on those in a bit as well. Marvel, please.
Yep. Thanks. And then our next to last slide here, we also asked caregivers about just barriers to technology adoption, to dig a little bit deeper into those individuals that maybe have not pervasively used technology or AI. And so despite a overall high tech engagement, there were barriers, and perhaps to the disappointment of those startups and founders out there that are looking to bring products to the market or have brought products to the market, cost was the number one barrier, close to, almost equal to, don't know which to trust. And so some of the feedback that we got that backs up some of this information is around caregivers really stating, I'm not inclined, or at least I've not yet seen a value proposition that would say to me, I'm willing to come out of my own pocket, or at least I see cost as a barrier, because these tools many times are helping them navigate a system that, from their mind, should really work better and should be more systemic when it comes to caregiver support. Having said that, it does leave us with the question of what is that value proposition, and making a clear value proposition to caregivers around what can be supportive and helpful in their own caregiver duties and responsibilities, could really see that change. Trust, as I mentioned before, certainly came up, and then privacy and security. And so not necessarily surprises in those two areas, but really that was top of mind for caregivers when they asked them about barriers as to why they may not be engaging with technology or adopting technology to their caregiver roles. And then the last kind of bottom half, understanding that they just didn't have time, that it was in their minds something that was just too much of it, overwhelming, or something that they just could not find the time and energy to research and find more information about, and so they just didn't, or it was just too complicated. And then lastly, of course, the care recipient, the person they're supporting, being resistant to some sort of technology adoption. And so levels and layers of barriers here to give an indication of why technology adoption might be lacking in some areas. And then with 14% of saying that they just prefer a non-digital caregiving environment for themselves and their loved ones. So for the last slide, we're just or the last slide of this section, and we're just gonna kind of wrap up and give you a sense that, this was a really interesting survey for us that we this was our first year doing it, and we worked with several organizations that were either in the market or looking to bring products to the market around technology or AI, as well as, of course, getting a lot of feedback and insight from the caregivers in our network. But one of the biggest data points that seems to have a high impact opportunity is that you got 59% of caregivers already using AI and a strong interest across multiple use cases. So not just one reason for using AI, not just one disease or condition or even age group. And then there really seems to be an appetite for responsible caregiver-centered AI tools. And so answering those questions around how to make the value proposition, how to be reassuring when it comes to privacy and security, and also really being able to gain the trust of those end users is some of the areas that perhaps might help that number move along further as participants, particularly in this AI challenge, consider their own solutions and participating in the prize challenge. I will pause there in just the interest of time so we have space for our roundtable discussion to be maximized. But as we mentioned before, what we will do is you will receive, I believe, and some from the ACL team, please chime in, but you'll receive information summarizing our conversation today, as well as we will be publishing publicly soon the full results of our Caregiver Tech Insights survey. So, Tal, thanks so much for helping bring this together. Tal definitely did the overwhelming amount of work that it took to get this together, along with support from our CAN team. So thanks, Tal. So now I'd like to invite to join with us Nicole Goebel, our Director of Community Initiatives, that will be helping co-facilitate our caregiver and direct service provider roundtable. Hey, Nicole, good to see you. As well, I'll invite to come on to screen and be pinned onto the screen Annalise Barron, Angela Cowders, Kelly, as well as Nick. Kelly Shepard and Nicholas Smith. Great. And then there's Angela. And while we're getting our pinning all straightened out, maybe we'll just do a really quick round of introductions if we could. If I'll just give you a call. If you could just say perhaps what you're willing to share about what you do professionally, and then what your connection is to caregiving. So if that's okay, Annalise, I will start with you.
Hi, thanks for having me. My name is Annalise Barron. I'm the executive director, executive director of a nonprofit organization called One Family Foundation. I'm also the caregiver to several people, an adult son with Down syndrome, a daughter with numerous learning disabilities and medical complexities, a father who is at end of life, and a much younger sibling who lives out of state, also with learning disabilities. Oh, and a mother who is showing signs of cognitive decline, who lives out of the country.
Yeah, you check a lot of boxes when it comes to caregiving, Annalise. So thanks for being here with us, Angela.
Hi, I'm Angela Cowders. I work in the government affairs and advocacy space. I worked on Capitol Hill for a long time and worked in the administration for 3 years. Personally, I was a caregiver for my brother and father. My father has subsequently passed, but my brother, who was actually born disabled with the very rare pain condition, he actually simultaneously, while I was caring for my father, was dealing with cancer and his recovery. And so that I got a crash course in caregiving, like all at the same time when I went home one Christmas. So that's my story.
Yeah. Thank you, Angela. Nick, how are you doing? Thanks for joining us. Nick is a direct services provider, and so glad you could add your voice to this conversation today, Nick.
Thank you, guys. Good afternoon, everybody. My name is Nicholas Smith. I am from Philadelphia. I am a direct support professional. I also work for, I'm also on the NADSCP board. Been in the field for over 25 years, so I'm very excited for this new forefront we're about to master. Thank you.
Thanks so much, Nicholas. Kelly, welcome.
Thank you. I am also from PA. I'm a direct sport professional in Pittsburgh. I've been a direct sport professional since 2008. I've worked in Michigan as well as Pennsylvania. So I've definitely, you could say, seen a lot of things, but I've also done a lot of things, and I'm always excited to do more or find ways to do less so I can do more.
Thanks so much, Kelly. Thanks for joining us. And Nicole, if you don't mind, would you share your connection to caregiving?
Yes, I'm Nicole. I'm part of the CAN team. I'm also a long distance caregiver for my mom with advanced lung cancer and COPD, and am a former caregiver for my grandfather who had bone cancer. Just as I call myself my mom's long distance caregiver, she will do the exact same and say that she is my long distance caregiver. I'm someone that was born with a rare chromosomal disorder. So, um, understanding and having experienced caregiving as both the caregiver, but also the care recipient.
Great. Thanks, Nicole. And I should not leave myself out. I'm a former caregiving youth for my mom who passed away a few years ago. I was a caregiving youth for her when she had a stroke when I was in my teens, as well as major surgery on her arm. And I also am the father of three kids that were all born premature and was a caregiver for them in their early years, needing a bit more than perhaps a customary birth would require. So thanks everybody for joining us today, and for everyone that's listening in. So Nicole and I are just kind of share some questions with you, and thanks so much for taking the time to get prepared for our session today. But Angel, if it's okay, I want to start with you and just ask a question around, what caregiving challenges would you most want AI to help you with when you think about the time you spent supporting your parents, the complications with your brother's health, and then just let's not even forget that you have to take care of yourself as well. What are some of those challenges that you would most want AI to help with?
I think the survey actually nailed it in my space as far as the burden to coordinate all of the efforts, the lines of effort, whether it was medication schedules, doctor's visits, fighting with the insurance company, which took up way more time than it should, dealing with Medicare in the case of my father, and then dealing with hospice care and that layering over the pre-existing care. It was really coordinated. As we were having this discussion, I was thinking, for my own health records, we use Epic or MyChart, if anyone is familiar with that platform. And I was thinking, I was like, well, what if like there was a system where you could just, text your doctor and they're supposed to get back to you by the end of the day with like an appointment or anything like that. And it's just like, it seems to be where there's kind of a central build for your records, diagnoses, medications. And I think something like that was more evolved, could be really useful. But honestly, it was things that normally in my own life, like scheduling a doctor's appointment, would take like 20, 30 minutes. When you're doing it for loved ones or other people, seems to take like hours. And also because as soon as you start getting into it and get on the phone, somebody's calling because they need you for something else in the other room. And I think like just getting pulled into a whole bunch of different directions was really where I felt like I was just running around like a chicken with my head cut off.
Yeah, yeah. I have a feeling that you are not alone in that metaphor, Angela, when it comes to caregiving. I want to adjust the question a little bit and start with you, Nick, and then go to Kelly around, when you think of your role, your profession as a direct service professional, are there things or what parts of your job do you think that AI could help you with?
That's okay. Thank you for the question. I gave great thought to this question. Just think about it for a second though. Like, as a direct support professional, in just in the shift or a day or just in a day, Kelly, we're doing so many tasks. Just imagine, like, for something simple as like a recipe. I want to cook dinner. The individual I'm supporting changes his mind or her mind. I have AI to say, hey, listen, you know, give me a simple recipe for a quick lasagna, right? Maybe I don't, or something that small like this food can change the day. Just like what Angela was just saying earlier, we use I personally use a my chart. It's so nice to have somewhere I can go and send my doctor a question. Not to say he's going to get right back to me, but at the end of the day, or just to see everywhere everything is at. Though I think as we're moving forward into the future, which is exciting because I'm excited for AI to come into my field and our field. At the same time, it's scary, right? But we're on the verge of like I said, of new innovation, new technologies, and also with a lot of parents and you also got to worry about privacy and protections. But I think we could, there are enough skill. We have so many great people on this panel and attendees that we can craft something that's going to be, that you still can have your answers but safe, right? Somewhere where as a parent, as an advocate, as a direct support professional, you ask a question and you're going to get you get various answers, but in a safe, I guess, parameters. So I think about all the wonderful things the little small things. I think I'm a great cook. I think I'm a fantastic cook. But if you ask me to make a English shepherd pie, I might, uh, you know. Now imagine having, at our company, especially people in Northeast and Philadelphia, we are utilizing Alexas. Majority of the homes have Alexas now. Obviously there's training with that. There could be some pushback. Individuals do have a right to say, "Hey, I don't really want the Alexa." So we're a slow walk. It's not like a forced thing. Maybe it's just a music playlist though. You can I've seen it. I've used it. Craft me a playlist with certain songs, music can be a change of a day. So I'm just like I said again, I'm excited for new AI intervention. Also I know I get it that it is a little scary, but I think we could just positive, we could just craft something that's going to be very beneficial to us. Thank you.
Yeah. No, thank you, Nicholas. And you took me right back when I was a long distance carer for my mom and towards the end of her life. Introducing Alexa, when I told her she could just say, "Play me some Temptations," she was sold. So it was not a hard sell from at least from a
Exactly.
music standpoint. So I totally get it. Kelly, I would pose the same question to you. What parts of your job, could AI help you with?
Well, first I do have to say that I agree with Nick about the cooking because there's nothing worse than a last minute mind change. But that's why I always have a rule of thumb is like as long as we use the same protein, I don't care what it turns into. Because it's a whole lot harder to, thaw something out. We already got something thawed. We just got to do something with it. But I think for me, I think that the the pressure I think for me is on completing the trainings and the because as a direct support professional or a caregiving person in general, I think we can all agree that the one thing that is most difficult for us is asking for help when we need it. And so I think that the thing that I would need help with is finding that time to complete my trainings because I would rather be helping somebody do their things and I don't really have time at home to just complete these trainings. So if there was like an AI tool like an earbud or something that I could be taking somebody for a walk and have this plan in my head, and not have to use my phone necessarily and my you know, in my phone battery and that sort of a thing. I think that being able to multitask in that way with an AI tool that could do the trainings audibly like in an earbud, and then I could answer questions, you know, verbally, you know, and have it be more of a Q&A, like with an echo where you can say, hey, you know, what do I need to know for ethics, you know, or
Hmm.
whatever the topic may be. Because as you know, Nick, some of these trainings are like 3 hours long, and they say that the state only requires 24 hours, but we all know we get probably about 50 hours of trainings that are assigned to us, and we get an 8 hour shift to do all of our supporting and still find time to train ourselves and learn. So if there was a way to multitask, I think that would be the best way. And I know that with programs like Open Futures Learning, where you can do side by side learning, and I can incorporate, you know, with the people that I support, we can do this training together. Sometimes that's helpful, but if it's a beautiful day like it is here, it's 73 degrees and sunny. Nobody wants to be in the house. Nobody wants to be sitting there at a computer doing trainings. People want to go to the amusement park, you know. It's a beautiful day for that. So finding a way to do training while still doing the caregiving,
Hmm.
but being able to more focus on both as opposed to having just like a laptop playing in the background somewhere and then trying to take a
Hmm.
test and be like, where did I hear that?
Yeah, yeah, that resonates, Kelly, especially when you see that much of the literature out there says that what you described is that on-demand training, and that isn't just sitting in front of a computer for 2 hours, is much more effective as well, because you're getting the insight and the training really while you are working and needing it in the moment. So the next question I have is, I'm going to come to you, Annalise, and it's around technology or AI that may have already helped you or failed you. And so, in thinking about technology or AI you've maybe used in your own caregiving experiences, have you had experience to use AI or tech that maybe was helpful, or that really was quite the opposite?
Yeah, so I think where it has helped me is just answer broad questions and help me think like what should I be thinking of? Like I don't know the things that I don't know. So I don't necessarily know to Google something if I get a diagnosis or something like that. But AI has helped me. If I just ask it, what else do I need to know? What questions do I need to be asking a doctor about this? That has been super helpful. Where I feel it fails me is when I try to get too specific and I try to rely too hard on the AI's answers and it gives me false medical information. And part of it is because the AI doesn't have the full history, and even though I might give it as much of the history as I can think of, it's still not a person that's taking into account all these other nuances. And so I've kind of gone down some wrong paths because of that. And I think also where a third place it didn't really fail me, but when I've searched for different providers in my area, sometimes it would give me providers that no longer exist or at the wrong location. So I was having to double check on Google to see, or their websites to see if that's actually true.
Yeah, and it hits, really a section we didn't get into during the caregiver tech insights, but that sense of trust. And if you are seeing that only 80% of the time, as at least one major study they're showing, of accuracy, that's a lot of energy you're spending to make sure that was accurate. And then when you find out it's not, actually looking for the accurate answer.
Yeah.
And so it's causing perhaps a negative return when you're looking for an overall net negative or net positive one. This next question I'm going to ask to each of you and then turn over to Nicole for the latter half of our conversation here. But, when you think about concerns or hesitations you have around AI and caregiving, Annalise, we've talked about this before, and you gave some really interesting insights around privacy as well as lived experiences that an individual may have that either you don't want AI infusing into its answers because of culturally or just systemically being marginalized. But I'd be curious to hear, what are some concerns or hesitations you have about AI and caregiving?
I think because my caregiving situations, and especially with my children, are so specific and they're minors, I always have this fear that like my name and my face is going to appear on some marketing material and said, and Lee's asked this question about her daughter, and this is what we provide. Like, I'm just afraid that that's going to somehow be out there without my consent.
Yeah. Yeah. And so not being able to have control or trusting that, because I haven't met anybody yet that reads that entire thing of terms and conditions before they click on it, but it's long, and there's a lot there to consider. Kelly, if I could go to you next, when in thinking about your role as a DSP, what concerns or hesitations do you have about using AI in your profession?
I would say kind of along the same line. It's a trust thing for me as well. I know that the thing that you hear most often just in general conversations about technology is, the 1984 Big Brother's watching, Big Brother's listening. And so, based on experience, or at least I know based on experience, that if I have a 25-minute conversation with somebody about pistachios, then I'm going to get ads on Facebook and Amazon. All of the ads that I see anywhere around me are all going to be pistachios or health related to fats and oils, things that are associated with that. So there is really no question that everything is always listening. And so for me, that comes into, the whole idea of, HIPAA, and what is it listening to? What is it holding on to? And where it's great that I can say, Alexa, what is the weather going to be like today? And Alexa will say, "Good morning, Kelly." That I asked it to learn my voice. But if I didn't ask it to do that, and then it started telling me my name, then I would be concerned because I work here. I don't own I don't own a what and so the fact that it's always listening, I think it would be hard for me to get behind too much in the medical field. I think that having it, I liked in the slides that we were looking at before about where we could use it for like plans and stuff. Where when you're doing like the support plans and stuff, if I could use if I could access the ISPs from anywhere just by using an AI tool, I think that would be great. Not having to log into something all the time, just be like, okay, I want to know this about this person. But then there's also the where is AI getting this information from?
Mm-hmm.
There's a general bias with where Alexa will Google things. If I'm looking at science fiction things all the time, then I may get a lot of sci-fi answers for things that I'm looking for factual things. And and
Mm-hmm.
and so there's so many biases, and the cultural side as well. That if it's just things that I like to watch on TV and then it gets pulled into information that's supposed to be helping me with something, then I'm not actually getting the direct facts. I'm getting what AI wants me to think of as fact.
Mm-hmm. Yeah, no, a really good point in understanding just where is that information being pulled from, and can I trust that, let's call it a large language model, that source of data that it's being pulled from. So I think we'll have to do a poll in a couple weeks and see how many people had pistachios come up in their Amazon cart or in their Google ads. But thanks so much, Kelly. Angela, I'd be curious to ask you the same thing. Hesitations or concerns about AI and caregiving.
I think mine is twofold. I agree with Annalise that I'm worried about privacy and a data breach, there's never been a system that has been created that can't be hacked. I think that is kind of part one. And part two is the accuracy of the information. Like if I'm getting ready to go to a doctor's appointment and I find out that, much like the transcription tool that doctors use now to help with their charting notes, it got the date wrong and I'm going into Atlanta traffic for like a 3 hour round trip, and turns out it's not the day of the appointment, I'm going to lose my mind. Because you're already like stressed out and at the brink almost every moment of every day. And so if like a tool that you're relying on screws up, you lose trust in it, and then it's not worth it.
Yeah, so it's like that whole trust thing we'll get into a little bit more in just a moment. But and once you've lost it, it's probably gone, at least for the foreseeable future for that line of questioning. Nick, I'll end this part of the questions with the same question to you. What hesitations or concerns do you have about AI in your role as a DSP?
Well, thank you. I agree with all the panelists. Like, we have to make sure, and here's my, half glass full, personality. Sometimes I think like we can craft. There's enough innovation. Right now, we're in what I term we're in the wild, wild west of AI. Right, different competing Claude, Gemini, all these different that are coming out. So just imagine that we can craft, together as a team, something that can answer questions factually, not listening. If you don't want to, if you want to make a profile, you can, but if you don't, it's not taking information. We all experience. I laugh sometimes because you know, sometimes I joke. I've said things to my brother's house, and I go home, put on YouTube, and I'm like, "Oh, look at that, the ice cream that I talked about," which is, at first can be a bit scary, but I find it funny. Like, wow, you guys are really listening. But just like you said, Mr. Adams, you're not. You have to go read these consents, and you have to go. I do it now, and you have to turn off the ad. So just imagine that we could, and we have a lot of innovation right here that can say, hey, listen, we can make something that I can use as a rest support professional, that I can get factual answers, privacy, keeping HIPAA in mind, making sure that I respect the rights and the wants of the people I serve, and help them. So I guess for me, I see so many benefits, but it has to be, with that much, information and power, there has to be some controls, right? There has to be able, every organization might want to have a little bit of control of what's out there, and that's great. There's so many benefits, like I said, that you can say, hey, playlist, or recipe ideas. Even Kelly, the idea she had about, I spend times doing training, that is my kryptonite. I said, but I work with a tense population for my unit, and in back of my mind, man, I got to do 20 trainings, but I'm having a great day. And by the time 10 p.m. comes, 11 p.m., I get off at 12, but it's part of my job, right? So my major concern is just to make sure that it's something that we can, which I know we can on here, the people that are watching can craft something that could keep some parameters and keep something, some privacy and HIPAA things, all built in one, where you're safe to answer. And just like Kelly said, when I go home, I'll go home, not coming, if I set statues at work, it comes up at home, right? So like I said, we're in the forefront of innovation right now. So, and just having the blessing and the privilege to be here to help craft some of this stuff is, it's amazing.
Yeah. Thank you so much, Nicholas. Yeah, I really like that point about being able to have some reassurances around really a firewall between what you did at work and the type of information you shared, and that being separate from your home life, which, by the way, I haven't asked you, but I would imagine each of you have been in unpaid family caregiver roles as well, which is not uncommon for paid direct service professionals. And so you have another aspect of this that certainly fits with our family caregivers. So Nicole, I'll turn it over to you for the second half of our Q&A.
Sure. Thank you so much. And thank you all for I think, I think really great insights that you've shared so far about kind of how you've been utilizing tech and AI. Um, this leads me into a question, as we're talking about, the things that we have hesitations, or concerns, regarding AI. I know that a couple of you spoke to trust earlier. Um, what is something that would instill trust in an AI or tech tool, for you, whether it's in your job as a direct service provider or at home with your loved one? And Angela, I'm gonna start with you.
Sure. I mean, I would say I'm very action oriented, so I would say that if like there's a screw up, I want a note explaining me how you fixed it and how it's not going to happen again. Or like what is the change you are now making to make sure that what has happened is preventable. That would be the biggest thing for me. Just getting like an apology note or update our software, it'll be better. Like that is just, it's not going to cut it. Particularly when you're dealing with family members, like it's personal. Everything that happens is personal.
Yeah, I really appreciate that. And I think it boils down to one word, which is accountability, right? To be able to say, all right, we're listening. We know that this didn't work very well. Here's what we're doing to improve, um, based on that. So thank you so much, Angela. Kelly, I'm gonna jump over to you. What would instill trust in an AI tool or a tech tool for you?
Um, it might be kind of a funny answer, but my immediate thought was something kind of like what they do with Hulu and Netflix, where they ask you upfront when you join the subscription, what are your interests? Well, sci-fi, what kind of, movies, music, Pandora, all these things, where it kind of, if you start with the baseline that you give the tool, that will kind of build that frame to start with, um, then I would feel like, okay, I can be more comfortable with it always listening, but it's going to be listening for these points that I've already input. If say I'm really into, business ethics or something like that. And so whenever something comes up that one of these AI tools might be able to say, "Oh, hey, we noticed not we noticed in your conversation, but like maybe like a fact of the day or something might pop up that said, well, did you know this and this and this?" That then it gives me something to kind of think about while I'm doing my job, that keeps me kind of in that realm. And I'm kind of thinking along the lines of maybe like the NADSP code of ethics. If that was like downloaded under like a AI tool, this code of ethics. And so then if it's hearing something and then it sounds like that's kind of breaching some of that, maybe that would alert you and be like, look, you're kind of stepping out, and then you're not ending up with the supervisory disciplines, and all these things. It's catching you in the midst of that because it's listening, and it's hearing what you're doing and saying, it can't necessarily disseminate whether you have sarcasm in your voice or whatever, and so that's where it's going to alert you. And so I think I can kind of put a trust in something if I get to start with a tool that I would input my interests, or if it was based on certain people, like I was saying before about like a support plan, where if we're planning to go out for dinner, maybe a pop-up reminder, so and so has this kind of a diet, maybe avoid this kind of food, or recommendations for how I can comply with this specialized diet, things like that. That as it's listening for 1,500 calorie diet, going out to eat.
Mhm.
Oh, pop-up notification. You're dealing with this diet. Maybe you want to think about a Caesar salad or something like that.
No, I think that's a really great point about the personalization aspect of how we can engage with these tools as well. We want to be able to have them know us a little bit so that it can be a little bit more intuitive. I think that's a really great point. Annalise.
Yes, I think for me, the one thing that would instill trust is right off the bat, letting me know how this information is going to be used. Is it going to be used to educate, blah, blah, blah? Is it the information is going to be separated from your name, or is it going to be just collected as an aggregate? Are we going to, well, we would never sell your information or share your information if that's true. But I think, one of the things that really stops me from, downloading different apps is like, oh gosh, this is just going to be another one that's just going to sell my phone number and I'm going to get, all those robocalls. I already get 50 million of them. I don't want to add more to that. So just understanding at least we know, like Angela said, that, every system can be hacked, but at least what is the intention with the information that's in here and being upfront about it. And it's not buried in the, fine print consent forms.
Yeah, I mean, that's kind of the running joke, right? Is that you get those terms of services and they're 80,000 pages long, and there's no way that you would be able to tell exactly what you're signing on the dotted line for. Nicholas, we'll close out this question with you.
Thank you. I agree with the panelists though, and I was just thinking about it for a second. Just imagine let's think about it for a second. Our emails, our own personal emails, how we got it crafted. Everybody on here has a personal email that is personalized to what we see. I think we can do the same thing with AI. Just imagine, just me in my imagination, you come to work, you're at home as a parent, and you want to customization and personalization, right? You want to be able, you can say, hey, listen, I want you listening so much half the time. Maybe I don't want suggestions all the time, or maybe send suggestions to maybe you're supporting a person and you don't want to, send suggestions to such and such, right? To my phone. I just think about all the different things that would instill trust, just to say, this is, upfront. This is your information is here. Like in our emails, it's not going nowhere else. You have the option to, if you want to share, you know, given provider organizations, parents, homes, advocates the choice to say where this information goes to no, I don't want to share this information, and just making it just like, we can go on our Google right now, change the background, change the font. We can cut out we should be able to do the same thing with any AI tool. And I think it's possible though. Like AI is getting better every month. Different versions are coming out. And I think that we can get to a point where we can gain trust if we have these parameters. But I know I keep saying parameters, but I think there has to be some parameters where, that you trust that this AI tool that I'm using, wherever it may be, wherever it may look like, is not going to go off anything I say like that. If there's something, if like, just like Angela said, if something behind the scenes messed up, there's a notification we fixed. We get those letters in the mail. Your data has been leaked. Sign up for all these things have to get put into AI because this is going to be it's part of our lives now. When we're driving in the car, when we answer playlists, from Spotify to all these different things we're using, and all this information is being compiled like that, So once we, as I say, with the Wild Wild West, we get some parameters and some control, we should be able to have in the future somewhere a tool that I can go to work. It's for work. When we set up how, the individualized for myself as a direct support professional, and something for the person that I'm supporting, where we could, if I need it, maybe it's not listening to me today, maybe it's listening to the person I'm supporting, or maybe no listening at all and no suggestions though. But customization, personalization, and just some priorities, I think will help me gain trust. Thank you.
No, that's wonderful. And I feel like there's a lot of connective tissue in what you all were saying about really all of the things and how you're serving, whether it's clients and their families or that family member, um, you know, using tech to make the caregiver's life easier is a complicated thing because every caregiving scenario is going to look different. Every one of us are going to have specific needs and wants. And so I think this is really insightful. I want to be mindful of time and know that we are getting towards the end of our time. So I want to say thank you to the amazing panel of folks that we were able to convene here, and Marvell for doing such a wonderful job at connecting folks with, I think, some of those hard-hitting questions that can help some of these developers in their next steps.
Awesome. Thanks so much, Nicole.
Thank
And we'll
you.
turn it back over to our friends at ACL.
Hi, everyone. My name is Larissa Cross, and I'm one of the our ACL team members here. And I want to just echo what Nicole said to thank everyone that joined our webinar today and just your overall interest in this initiative, the Caregiver AI Prize Challenge. And as you heard throughout today, that the challenge is, of course, is focused on technology, but more importantly, technology and being able to come up or create a solution that truly supports caregivers, direct support professionals and families in a meaningful way, but also, as Nicholas, I think, mentioned a lot, also finding safe ways as well. So we appreciate the insights from all of the direct support work professionals that were on the call, as well as our family caregivers. And again, thank you to the CAN team for facilitating this discussion today. We appreciate your insights today, and we want to encourage everyone to utilize the resources that were provided in the chat and the links. Also, including, we want to encourage you to also utilize the Slack community that the ACL has developed for your use. And also to pay attention to those upcoming dates. Those are posted on our website regarding the application materials as you move through this process. So we are excited. We are very excited to see the innovations, the ideas that you come up with, and look forward to just what we see as we work on a solution to that focuses on supporting caregivers and supporting families utilizing tech. So again, thank you so much for participating in this webinar today.